So good morning, everyone. Thank you for joining us for our latest media briefing on important healthcare issues in the news. I'm Dr. Adam Kassam, president of the Ontario Medical Association, which represents more than 43,000 doctors. We are entering year 3 of the COVID-19 pandemic, and Ontarians, like most of the world, are dealing with the impact of the highly contagious variant Omicron. We'd hope that by now, with vaccination rates that are the envy of the world, inoculations for children ages 5 to 11, third doses for everyone over 18, and fourth doses for some, that we would be transitioning to an endemic. And we're getting there, but we're not there yet. Our hospital capacity is being stretched and our healthcare system overburdened. A new survey by Ipsos conducted for the Ontario Medical Association has taken the pulse of Ontarians, providing insights into what they are thinking and what priorities they have for healthcare and government in general. The survey was taken from December 7th to the 13th, just before Omicron barreled into our lives. And it followed widespread public consultation by the OMA that led to a series of recommendations by Ontario's doctors to improve the healthcare system. And doctors are on the right track. 96% of Ontarians told Ipsos that they support the 5 priorities doctors identified. And just to remind everyone, those priorities are as follows. Number 1, reducing wait times in the backlog of services. Number 2, improving and expanding home care and community-based care. Number 3, giving every patient a team of healthcare providers and linking them digitally. Number 4, strengthening public health and pandemic preparedness. And number 5, expanding mental health and addiction services in the community. And you can read more about our recommendations in Prescription for Ontario Doctors' 5-point plan for better healthcare at oma.org. To talk more about the Ipsos findings, we are joined today by Sandra Guiry, Senior Vice President, Canada, Public Affairs at Ipsos. And I'll start by taking a look at some of those highlights. So when asked to identify the issue that is most important to them, Ontarians chose COVID-19, followed very closely by the backlog in healthcare services. Younger Ontarians are more interested in mental health issues, suggesting a significant and perhaps growing generational divide. Ontarians are willing to trade off economic growth for healthcare spending, at least until COVID and the backlog of care are dealt with. And finally, housing affordability and climate change have risen greatly as priorities for Ontarians over the last 8 months. Respondents were asked to think about issues facing Ontario and chose which item from a list that they were provided should be prioritized by the government. And COVID-19 was identified as the most important issue by 40% of those surveyed, and that's down from 63% in April because other issues moved up, not because necessarily it's less important to them. And 10% of Ontarians said that the government should prioritize healthcare, long wait times, and understaffed hospitals. 7% of respondents said economic growth should be prioritized by government. Ms. Guiry, will you take the next slide?
Yes, thank you, Dr. Kassam. The survey showed that Ontarians are so focused on healthcare, they appear to be willing to trade off investment, economic growth, and recovery for investment in health, at least until the backlog is cleared. When asked to choose which is higher of a priority for them, the backlog in surgeries was chosen most often, 51% of the time, followed by improving and expanding long-term care facilities for seniors, which was chosen 47% of the time. And both of these were chosen more often than stimulating economic growth, which was chosen 39% of the time. On the next slide, when we asked, aside from COVID-19, what should the top priorities in healthcare in Ontario be? Respondents said, unprompted, reduced wait times, hiring more hospital staff, caring for seniors, and clearing the backlog of surgeries.
So in fact, we've shared OMA data with you before that showed that the COVID-19 pandemic, unfortunately, has created a backlog of almost 20 million patient services, including preventative care, cancer screening, surgeries, and diagnostic tests such as MRIs, CT scans, mammograms, and colonoscopies. And catching up on this backlog, as we know, will take years. And we know that the backlog is continuing to grow as surgeries are now postponed while hospitals manage the significant rise in patients being admitted with COVID during the Omicron surge. And our Prescription for Ontario report includes recommendations to deal with the backlog and overall investment in healthcare. We also know that healthcare funding isn't keeping up with the pace of demand, and that the Canadian Institute on Health Information data shows Ontario is 9th out of 10 provinces in provincial healthcare spending per person. And compared to other countries, Canada ranks 23rd out of 32 OECD countries in doctor to population ratio and is 4th from the bottom compared to other provinces. So transforming the healthcare system and mental health ranks 2nd and 3rd in terms of healthcare priorities for Ontarians. And while older Ontarians care more about wait lists and the backlog, younger people are more concerned about mental health. Recently, the younger generation has prioritized mental health, and they are more aware of it and perhaps even more open to talking about it and perhaps even more open to seeking care. 25% of people aged 18 to 23, which is the Gen Z, and 22% of people aged 24 to 39, which is the millennial generation, said mental health should be the top priority. 16% of people aged 40 to 55, so Gen X, and only 10% of people aged 56 or older, which are the boomers, ranked mental health as their top healthcare priority. And as I said earlier, Ontarians were asked about the recommendations in our prescription for Ontario. And so 96% of Ontarians said that they support the 5 pillars of the plan. And when asked to rank these priorities, Ontarians picked wait times and backlog as the #1 priority, then expanding home care, and then community care. And so I'll now turn it back over to Ms. Guiry, who will tell us a little bit about what the unvaccinated are saying.
Thank you, Dr. Kassam. That's right. We asked Ontarians we surveyed about their vaccination status and then probed them a little bit deeper to understand the decisions people are making not to get vaccinated. So in this survey, we show that 1 in 10 Ontarians report that they have not been vaccinated against COVID-19, or they've only received 1 dose. 7% do not plan to get vaccinated. Among those unlikely to get vaccinated, they are more likely to be, as noted, millennial or Generation X, and they're more likely to be women. Those in these age groups, for them, it's more about a personal choice, although the top mentions are listed there on the slide as well. As I said, the survey gives us some insight into why the unvaccinated remain so. On the prior slide there, 24% or almost 1 in 4 say they were afraid of side effects, with the same percentage saying they do not trust the information coming from government. Other mentions include a personal choice to wait, don't believe the vaccine is effective, dislike of needles, have medical reasons, or were not sufficiently concerned about COVID-19 to get their shots. And I think that last slide concludes the findings. Now I'll just take a moment to explain how the survey was conducted and who took part. So as Dr. Kassam mentioned, this survey was conducted prior to the increase in Omicron variant cases that hit Ontario. That was the survey dates were December 7th to 13th. And the survey was based on a representative sample of 1,000 Ontario residents who were aged 18 and over. So this survey data based on that sample size is considered accurate to within 3.5 percentage points, 19 times out of 20 at all Ontario adults been surveyed.
Thank you, Ms. Guiry. And as we see from these results, people in Ontario have a laser focus on the COVID-19 pandemic. They want to know the healthcare system will be there for them when they need it. They know they can't afford to wait for the services that they need. And they want government to prioritize healthcare spending over the economy, at least until COVID and the backlog of care are behind us. The recommendations Ontario's doctors are making to improve our healthcare system for patients are in alignment with what Ontarians say that they need. Ontario is fortunate enough to have some of the most talented and most committed physicians and healthcare providers in the world. And the Ipsos survey shows us that doctors, like other healthcare professionals, hold the trust of Ontarians. And we also know that the pandemic has shown that there are deep cracks within our system. And even before the pandemic, there were long wait times to see specialists and access critical diagnostic tests, treatments, and surgeries. And at least 1 million Ontarians don't have a family doctor and can't get the treatment that they need. Healthcare funding has not kept pace with need as our population grows and gets older. And as a province, we have the financial means to properly fund a healthcare system that should be more than just adequate. It should be first rate and ensure everyone gets the care regardless of who they are or where they live. So with that, we're going to now open up our Q&A session. Mr. Lucas Myers will be moderating this portion of today's briefing, and please put your questions in the Q&A chat. I know that many of you have already done so, and if we don't get to your questions due to time, the media team will follow up with you as well. And you can also email media@oma.org with additional requests for interviews. We will also have a recording of this session available later this afternoon. So with that, Lucas.
Thank you very much, Dr. Kassam. Yes, ladies and gentlemen, for questions, please chat them in the Q&A. Appreciate that. First question will go to Ms. Guiry. How different do you think the survey results would have been if conducted after the Omicron wave? And do you think we would see the same trade-offs and priorities?
So it's an excellent question. And as we all know, surveys are a snapshot in time. However, the results we're seeing in the sense of the Ontario population being willing to trade off economic recovery for investments in healthcare has been something we've seen consistently throughout the polling we've been doing throughout the duration of the pandemic. And I don't suspect that we would see much difference yet. Potentially further down the road, there might be a reconsideration in terms of different priorities. But at the present time, given where we are, I think this data still holds a lot of accuracy.
Thank you very much. Our next question comes from Emma Jones. It's more of a clarification with regards to some of the findings. Did the surgery results show that millennial and Gen Z women were most likely or least likely to be vaccinated? So a question of clarification there. Did the surgery results show that millennial and Gen Z women were most likely or least likely to get vaccinated?
So the survey showed that of the portion of the population that is unvaccinated, they're disproportionately more likely to be millennial and Gen X.
Excellent. Thank you, Ms. Guiry. Our next question will go to Dr. Kassam. Can you talk a little bit about the solutions with regards to those findings around Ontarians being most concerned about the backlog and the wait times, those two issues? What's in your mind going to fix those critical issues?
Yeah, so the backlog and both the surgical wait times as well as procedural wait times rank, as we've already described, very, very highly for Ontarians in terms of priority. And so when we think, and I also have to make the distinction that we are also talking about wait times for even specialist care, even primary care. So it's not just procedures and surgeries, but it runs the gamut across the healthcare spectrum. But with very specifically with regards to surgeries and procedural care, what we have a number of recommendations that we believe will help to move through this backlog. So here are a few examples. The first is to ensure that more procedures and surgeries are completed in community-based specialty clinics and settings in order to offload hospitals. We also know that making sure that we have remote home monitoring, pre and post-surgical care technology that we can leverage for some of that throughput is going to be very important. We also know that leveraging technology to ensure that systems are speaking with one another, so hospitals and clinics are talking on the same sort of digital spectrum, that's going to be very, very important. And then finally, of course, making sure that we not only have the infrastructure, but the resources to put into a backlog of care project and infrastructure is going to be very important for the future.
Thank you, Dr. Kassam. I think the next question goes to you. This is from Sinead Dougal from QP Briefing. Based on the results of the survey and the priorities Ontarians identified when it comes to healthcare and the pandemic, how would you rate the province's actions in addressing these priorities?
Well, what I would say right now is that we're obviously still focused on Omicron and ensuring that we are shoring up our system as we speak. We also know that we're under something called Directive 2, which is a specific policy lever that has been used throughout the pandemic in order to ramp down services, in order to make capacity available in hospitals and other acute care settings. And so we also know, and this I think is a very important point, we also know that healthcare is a team sport. So in our platform that we launched a couple of months ago, we've called for increase in healthcare spending by not only the provincial government, but also the federal government as far as Canada Health transfers are concerned. And so this really requires a heavy lift by all stakeholders, and it requires all of those partners to be at the table to think about now and for the future.
Next question goes to Ms. Guiry. How significant, you talk about the polling aspect of this, how significant is a polling of 1,000 Ontarians? And was there a particular finding that was perhaps more surprising than others? So the significance of the size, and was there something that kind of caught your eye?
So the sample size of 1,000 is very typical for what we do, and it is considered to be robust for the population, not just the population of Ontario, but often for larger populations, including the population of Canada. So it's a very standard, and we feel comfortable with the degree of accuracy it produces, 3.5% in this particular instance. In terms of what stood out for me, I think the interesting part is the growing, and we haven't shared with you some of the past tracking we have on this, but the growing divide that there is between the generations in terms of healthcare priorities. I think across all age cohorts, we're seeing that healthcare spending is being prioritized, but it's interesting how it's prioritized slightly differently, or sometimes not so slightly differently between different age cohorts. So I think that's going to be something really important for us to keep an eye on, and recognize that there is that sort of gap that's existing.
Thank you very much. Next question goes back to Dr. Kassam. Talking about some of those priorities around housing affordability and climate change rising, what do you think has sort of propelled those two issues to rise as priorities in the findings of this latest survey?
Yeah, I think a lot of this has to do with the impact of the economy as well as the impact of the health sector. And so when we think about right now with inflation at really high numbers, we know that housing affordability is drawn into that calculus for not only a younger generation, but people perhaps looking to enter the housing market or even rise up the housing market ladder. And of course, climate change, which is part of the concept of social determinants of health and being able to ensure that, future generations have a robust, but also a sustainable environment and economy. I think those two things kind of go hand in hand. We're seeing that in other sort of sectors as well, in industry and in manufacturing and in others. And so I think that when we think about it as from a system level perspective, I think that all of these factors have a role to play. And it's part of the reason why a lot of Ontarians are choosing to identify these as priorities for themselves and for the future.
To Ms. Guiry, we talked about this a little bit before, but how should these survey results, in your mind, sort of inform government decision-making and the decisions that they make with regards to information and data like the ones that we just saw in this survey?
I think these surveys are immensely valuable. They serve a great purpose. And I think it's important, particularly with this poll, we were very careful to make sure that we were including in the survey open-ended questions where people were unprompted and could speak whatever they wanted to report in terms of their priorities, but then ask them to make trade-offs, because trade-offs really is the challenge of government, right? So I think what was really strong about this poll is that the data is consistent throughout the different ways we asked about priorities. And so I think in terms of grappling with at what point and to what level do you make changes in terms of your investments, I think the feedback from the public and how that may be shifting is extremely important to pay attention to.
Excellent. A reminder, folks, again, if you have questions, the Q&A function of the Zoom call. Our next question goes back to Dr. Kassam. Doctor, what has the response to the R naught value been? And is there interest in sort of adopting those types of recommendations based on the rate that we're seeing? Obviously, we talked a little bit before about Omicron and the type of impact that it's had. What has your response been to the sort of rates that we're seeing with regards to the virus?
Lucas, I think the question was more about the prescription for Ontario, not the R naught number, but I'll answer the prescription question. And so that's the platform that we launched approximately 2.5 months ago. And it includes all of these 5 pillars that we're describing. And the highest of those pillars is, as far as the public is concerned, is of course backlogs and the pandemic wait lists. And sort of broadly speaking, I think that there has been a lot of very positive feedback from a lot of different stakeholders. Now, we have to remember that this was the largest consultation in our 140-year history. It included 110 healthcare stakeholders. It included 1,600 members of our association. It also included 8,000 members of the public across 600 communities. So in fact, this is really Ontario's priorities, the priorities for what Ontario and the people of Ontario want for their healthcare system moving forward. And we've had very good conversations and commitments to delve deeper into these pillars by all of the political parties. But what we're going to be using this platform as a roadmap for the future is to hold all of these people and parties accountable for the future of the healthcare system in Ontario.
Thank you very much. Dr. Kassam, as well, sort of another, again, on the generational divide a little bit. Can you perhaps, elaborate more on that generational divide in terms of what different people prioritize in their minds going forward?
Yeah, this is a really important question because I think it really speaks to access to care in slightly different ways. And so when we think about a younger generation, talking a little bit about access to mental health care, for example, these are sort of issues that, and perhaps even healthcare issues that individuals in these younger generations are experiencing in real time. And so they see this and they're feeling like they need access to these types of care services. And that differs from, let's say, an older or elderly generation who needs services in slightly different ways. So perhaps someone who is 75 might need a hip or knee operation because they have debilitating osteoarthritis. That might not necessarily be the case for someone who's 25, but the 25-year-old might have mental health challenges that they're looking to help to need help with. And so I think when we think about access across the sector, this is an issue. It just is stratified based on need. And of course, that happens to be related to age as well.
A few more for you, Dr. Kassam. This is actually some new comments that we just heard from the health minister, Minister Elliott, speaking earlier today. She talked about how she was concerned that some doctors are spreading, false information around vaccines and vaccine safety. And she's actually said earlier today that she'll be sending a letter to CPSO asking them to do really everything they can to put an end to this behavior and should consider all options, including suspending the licenses of people doing this, kind of taking away from the efforts of the vast majority of physicians who are working to help us all, and vaccines obviously being the best protection for this. So when you hear that type of commentary coming from the health minister, just your sort of general response hearing that from the OMA's perspective.
So, Lucas, we have been clear from the very start that vaccines are safe, they're effective, they are our best protection against COVID-19. And we have been advocating and educating not only the public, but also our healthcare partners to ensure that we can roll out doses into arms as best as we can and as quickly as we can. It's why we've been focused on this third dose campaign right now. And, I've gone into vaccine clinics over the past month, ensuring that we are providing the best protection. As it pertains to the regulatory environment, in the CPSO, of course, the college has a responsibility to protect the health and well-being of the public, and this is sort of their jurisdiction. And so all of those comments can be directed to the CPSO. But what we have been very clear about, and we're going to continue to do the strong work of, is ensuring that Canadians and Ontarians have access to the best, the most accurate information. And that includes making sure that they are well informed about the benefits of the vaccine.
Excellent. And I believe this will be our final question of the day. Dr. Kassam and Ms. Guiry, thank you very much for giving us your time today. The final one, again, talking a bit more about that generational divide, Doctor. Again, back to the unvaccinated issue. Why, in your mind, in looking at the data, why are millennials and Gen X those most likely to get unvaccinated? And what would explain why women are in that sort of reluctant group that we saw from the findings? That'll be our final question of today's session. Dr. Kassam.
Yeah, so of course this survey is observational and doesn't really drill down into some of the reasons behind the data. However, there are a few hypotheses that we could make. Younger folks tend to consume social media and alternate media in a little bit different ways than older generations, and so we know that there's been a propagation of perhaps disinformation and misinformation in these platforms that could potentially lead to or influence an individual to make a decision based on perhaps faulty information. So that would be perhaps one hypothesis that I could offer. As far as sort of a gender discrepancy, I think that that's something that would need to be further investigated in order to better fully understand.
And before we wrap up, obviously would like to ask both our panelists if they have any sort of final thoughts or comments that either of them wanted to add with regards to the findings of this survey.
I'm happy to let Dr. Kassam go first.
No, I'm okay. Actually, I'll leave it with you, Ms. Guiry.
No, I mean, I think this research is delivering important information, and I'm glad it was undertaken. We're happy to be part of it. So I think it's important to get out there.
Absolutely, and the only thing I would add, Lucas, is that this survey really just validates what we've been, the work that we've been undertaking over the past 20 months, not only with the OMA, but of course in the health sector. And that really is a focus on ensuring that we are building a roadmap for the future of healthcare in this province. We believe that there are certain areas and priorities that need our immediate and continued attention. And these are areas of collaboration that we hope will resonate with not only members of the public, but also policymakers, governments, as well as healthcare partners. And we're going to continue to do the work to ensure that not only the priorities priorities of Ontarians are met, but also doing the work to actually deliver care in a timely and effective way. And so, with that, what I would like to do is just make a few closing remarks and thank everyone for attending today's briefing. You had very thoughtful questions. And I know it's a very busy day for the media in terms of dueling press conferences and a lot of different surveys being released today. So I want to take a moment to thank you for attending today. I also want to take a moment to thank healthcare workers for their extraordinary efforts on the front lines of the pandemic, especially over the past little while, and Snowmageddon even a couple of days ago. And so I know we're trying to dig out a little bit here in the GTA, but across the province as well. The last 2 years have been challenging, to say the least. And our millennials are right. They have concerns about the impact of the pandemic, not only on their mental well-being, but really just on the well-being of society writ large. And so I want to encourage everyone to take care of themselves, to look after their mental health. Bell Let's Talk Day is next Wednesday, which is another good reminder to reach out for help if you need it. Thanks again for your time.